Jeremy Howard speaking to us. Jeremy has worked in real machine learning and AI for many decades, producing models and actually deploying them in the real world, unlike many of us who just hang out and do it in pretend academia land. So he has a great deal of experience in both industry and in academic contexts around machine learning and AI. He's also the co-founder of fast.ai, which is a fantastic library of machine learning and AI resources, which is open sourced and has been a great resource for many, many people to get them started and get them going, building sophisticated models and as an entry point to using machine learning in the real world. I myself have used fast.ai, and it was how I got introduced to building and utilizing machine learning models in my own research, and I'd thoroughly recommend it for anyone who likes learning by doing. So if you like learning by hands-on, then it is a really wonderful way to build sophisticated models and gain good understanding of how they work in real contexts. So Jeremy, like many of us, found himself caught up in the COVID pandemic and was really a long way ahead of the curve in wondering about the use of masks and how efficient they were at mitigating the transmission of COVID. So I think fairly early on in the pandemic, when there were a lot of scientists who were still equivocating about whether it was worth looking at this, Jeremy launched a kind of self-motivated research into this field, made contact with lots of people to develop a good understanding of the use of masks. And that's what he's going to be talking about to us today. So Jeremy, thank you very much for coming along, and welcome.
Thanks very much, Sally. So today I'm going to reveal how a little-known data scientist convinced the West to wear face masks. The little-known data scientist, of course, is me. This article appeared in the Telegraph in July of last year, talking a bit about my journey, but I will dig into it in a bit more detail today. To be clear, I have no background in or previous interest in face masks. I have never worn one other than once in a hospital when I had to for a friend's procedure. And quite honestly, I find masks, kind of tedious, boring items of clothing. So this was certainly not a passion project for me for a topic with which I have great joy. But it comes from the fact that we talk about ethics a lot in our courses and in our work, and specifically data ethics, which covers a lot of things. But as a general principle, one of the things we always tell our students is that as a data scientist, your goal is to impact the world, in some small way, ideally positively impact the world. And that means that when you identify something interesting in data, then to do something about that, and to also, if somebody else is doing something about that, to try to make sure that the thing that they do with that is done as well as possible and is as societally useful as possible. So this is our, whoopsie daisy, this is our data ethics course at ethics.fast.ai, which is taught by my partner, Dr. Rachel Thomas. And so in the early days of the pandemic, Rachel and I, in kind of late February, early March, started kind of trying to look at what the data was telling us about COVID. And if you remember at that time, there was fairly polarized views kind of in the media and and in social media between, oh, you know, COVID's this thing that maybe could get pretty bad, but more often most of what I read in the kind of the media was people should stop panicking, people are overplaying this, you know, it's just a coronavirus, it's probably not a big deal. And so what Rachel and I kind of did in looking at the data to that point, kind of late February, was to kind of say, let's take a look at places where COVID's already taken hold and see what we can see, you know, so like case numbers, hospitalizations, but also things like how have regions responded. And also one of the things that Rachel and I are particularly keen on, which might be surprising as data scientists, is we're very keen on individual narratives and stories. You know, data can often hide the kind of the compelling narrative of an individual. And so we also tried to really read about like what were doctors actually saying from places like Italy and stuff like that. And so in the 9th of March, we actually published a article with our kind of summary of what we had found, which was basically, oh, we're pretty worried about COVID. We're particularly worried about the vulnerable parts of society. We're particularly worried about the exponential spread that we were seeing in places like Lombardy. And our university, USF, was good enough to publish some of what we were talking about as well. And it was amazing. We had, well over 500,000 people read this, which is more than anybody had ever read anything on fast AI before. And lots of people came and gave us translations of it. And it was, you know, this is something that we kind of did partly for our, kind of heavily actually for our own community. You know, we're in San Francisco and we wanted our friends and family and community to understand the importance of taking this seriously. Yeah, but, you know, then we were getting emails from all around the world from people telling us about how they had, you know, from people who run hospitals or people who run companies and so forth, saying how they've changed their behavior or their policies based on this. And it seemed to make a really big difference. So as data scientists, that was, you know, really encouraging to see that when we put something out there, even though it wasn't our particular area of expertise. I mean, medical data analysis is my medical expertise, but public health in particular is not something I'd spent time on. But, you know, despite that, we're able to make a positive impact. So also around that time, the US Surgeon General said, don't buy masks. They're not effective in preventing the general public from catching coronavirus. That was the end of February. And, you know, interestingly, in the stuff we wrote back then, we didn't even mention masks. It wasn't particularly on my radar. But I was kind of curious about it. And I was particularly curious about it given this tweet, because it said that healthcare providers, if they can't get them, it puts them and our communities at risk. But they don't help us. And I thought, that doesn't make logical sense. And I kind of started thinking about it and I started looking into a little bit and I was kind of thinking like, what's going on? Either they do work, in which case to help, you know, decrease transmission, in which case healthcare providers and the rest of us need them, or they don't work, in which case none of us need them. Which is it? And I was a bit suspicious that probably what was going on was that actually they do work. And this kind of messaging was designed to convince us not to hoard them so that healthcare workers could use them. And I thought if that's true, that's a big problem, because telling the public that something that does work actually doesn't work is going to cause long-term harm. So for kind of this and a number of other reasons, I kind of started looking into masks a little bit. And also I kind of did it because I was recording a new course at the time, and I kind of wanted to have some material about studying evidence more generally and how data science fits into that. And I thought it'd be an interesting case study. So I spent a few days looking into it. I wouldn't say I went into lots and lots of depth, but enough that in the next course that I recorded, the next lesson I recorded, I had a section of, how long was it? About half an hour, talking about why, from what I could see, it seemed like masks are likely to be useful. And to be clear, I didn't even make that a separate video. It was just part of the lesson that I recorded. As you might know, fast.ai lessons, it's generally a few months between when they're recorded and when they are all ready to be published. But the people in the class, because it's also live streamed, a lot of them said you should take that masks bit of the lesson and publish it right away. And I thought, sure, yeah, I mean, that makes sense. And so I did. Yeah, it became one of our most viewed ever videos very quickly. A lot of people seemed interested in this topic, which kind of surprised me because no one was talking about masks, and it seemed pretty niche, and it's just this like data science perspective on this rather niche issue. Anyway, so that was kind of where it came from. And then what happened a day or 2 days later, a guy, an editor from the Washington Post emailed me and said, I saw your video and I think you should write an article about it. So I did. And to be clear, I'd never written an op-ed for a major newspaper before. And so it's all about kind of, doing my best to be helpful, I guess, despite not having expertise in this particular area again. And so I wrote this article that basically was the first in the English-speaking press to just directly come out and say we should all wear masks. So this was the start of the movement in the English-speaking world. And so it's kind of nervous to put yourself out there like that, make a very direct claim like that. But I felt like the data was pretty clear about it. And so I should communicate it as directly and clearly as possible. And I was lucky enough to have a couple of friends who have written lots of op-eds in big papers, and they helped me edit my piece. And they just cut away all the extraneous material to make it as direct as possible. And so it's an interesting experience. It's so different from academic writing, where we're used to kind of putting in lots of caveats and lots of reasoning before we kind of get to the point, whereas communicating a public health message like this is all about being as direct and straightforward as possible. So that was an interesting experience. So I heard from the Washington Post that this was one of the, for this week, I think it was like their most read article. And it was amazing. The next day, basically every major American TV station contacted me and said, we want you on our show. Again, this is not something that's very comfortable or familiar to me, but I thought, well, that's great. If we can get the message out, let's get the message out. So, I think that was really helpful to be able to say, like, okay, I'm a data scientist, and based on my research so far, here's what I see. And it was great also being able to be on shows like Joy Reid across from public health experts like Ashish Jha from Harvard, to kind of like get that credibility of, having somebody who this is very much their field, supporting the message. And yeah, it was amazing how quickly things moved. When I first started going on the TV shows I got a fair hearing, but I'd also say there was a lot of kind of dismissive reactions. But yeah, then they started bringing Fauci onto the same shows that I was on and like asking him. And each time he came on, he'd be like slightly more positive about it. And within 3 or 4 days, he started saying, yeah, okay, this is actually, wearing a mask might actually be helpful. So, later on in May, I actually worked with a doctor named Vincent Rajkumar to get 100 of the world's most respected health leaders to co-sign a letter to governors saying we should require masks, and then send it to Fekchi, and I wrote an article in USA Today about that. And so I had, quite a few different things going on. So then a couple of US senators contacted me, one Republican and one Democrat, and they were keen to push this message through the American political world as well. But they were getting pushback from the CDC about just the quality of the science, which is fair enough. There wasn't much science and certainly not much curation of that science. And so I thought, okay, it's kind of weird how I went from, knowing less about masks than just about anybody in the world to suddenly being the person that people were coming to and saying, we want you to, help figure out how to convince the American government of this. I thought, well, I'm not the right person to create a scientific analysis of this, like at least on my own. Even if I could do it, there'd be a credibility gap in terms of just my background's not the right background. So I reached out to about 20 people who I had come across on the internet, who basically seemed the people who were the most competent in their fields, and said, would you help me write a paper about basically looking at the evidence for or against mask wearing. And basically all of them said yes, which really shocked me because I've never done anything like this. I mean, honestly, I'm a pretty introverted kind of person. I don't really like reaching out to strangers. But again, it kind of felt like something I had to do. I didn't know if anybody would say yes, but yeah, everybody said yes. And so we ended up with one of the world's top aerosol scientists and executive director of Stanford Medicine X and a top biostatistician, all these amazing people. And so I led this team to write a paper. And we wrote the first draft in like maybe 5 days. Like we really just pushed it. And I got a lot of help from Twitter. I asked on Twitter, like, does anybody know any papers for or against, evidence for or against wearing masks? And ended up with about 140 references. I read every single one of them. And we ended up publishing this paper in early April. We decided to put it, first of all, on a preprint server because, we were, I was getting, I wouldn't say hassled, but encouraged nearly every day, like by folks familiar with the CDC conversations and the WHO conversations saying we need this now. So we put it on a preprint server on preprints.org, and much to my surprise, very quickly, it became the most downloaded and viewed paper of all time on preprints.org. And what I didn't know at the time was that we submitted it to the Proceedings of the National Academy of Sciences, to PNAS, and an editor from PNAS was a real supporter of ours. It really couldn't have been in a better position to kind of get that paper through. But it took about a year to get published. And like, that's a whole nother story of, the politics and messiness of academic publishing of a controversial public health related paper. It's definitely not just about the science. And if we hadn't have published a preprint, our evidence review would have missed the entire period during which this was actually really particularly relevant. When it eventually was published in PNAS, like I say, nearly a year past when it needed to be, it's become the third most impactful based on altmetrics paper out of almost 100,000 ever published by PNAS, and in the top 100 of the 20 million papers that have been measured in all time, full stop. So even the published version of it has been super impactful, even though it was ridiculously delayed. So, this was an interesting paper. It was an interesting experience of working with nearly, with 19 people, none of whom knew each other, all of whom were in different countries, different time zones. We did we never had a call or anything. It was all just done through discussion through WhatsApp and using Overleaf and collaboration. And, I'm really proud of the paper that we created together. I think it's really high quality and we've received a lot of great feedback about it. So that was, that was a great experience. And so despite how tedious studying masks is and reading 140 papers about the size of people's saliva droplets and the number of virions that you can fit into a droplet and the length of time it takes to evaporate and blah, blah, blah. That's all pretty boring, but it was really cool to be able to make all these new friends who are really passionate and interesting people. So that's certainly been a great outcome for me. So in terms of what does the data look like? This was actually the data I found the most compelling, which is image data. The guy called Bax, the Bax Lab at the National Science Foundation did this laser scattering chamber experiment where they were speaking. And as they spoke, you can see these micro droplets. They're not normally visible, but they are in the laser scattering chamber. And then he just put a piece of paper towel over his mouth and said the same thing at the same volume. And the droplets nearly entirely disappear. So this is published in the New England Journal of Medicine. I guess I can't say too much about this because it's not my paper to talk about, but if you look, this was actually on YouTube a long time before this paper appeared. So they were publishing the results of their experiment very early on. And, for them, they had a similar issue. Actually getting published is extremely challenging when you have evidence which is directly contradicting an official public health body like the CDC or the WHO. It's really hard to publish literally experiments and data if it doesn't back up the official message, which is something I didn't realize. I kind of thought scientists can publish science, but yeah, it's really hard to publish science that says things that people don't want it to say. So anyway, so I thought this was as compelling as it can be. A piece of cloth or a piece of paper stops the thing that we know transmits the virus, so therefore it works. Unfortunately, in the world of epidemiology and infectious disease control and public health, these kind of lab tests have zero weight. The only thing that has weight is kind of epidemiological data, which is, randomized controlled trials, which makes life very, very difficult to convince the people that actually set these policies. Yeah, the other amazing thing that the same team showed in a paper a little bit later was that those droplets that they were looking at, they actually measured them for a period of time and discovered that they stayed floating in the air for up to an hour. And this was again, early 2020. And so for those of you familiar with the kind of the aerosol debate about, is COVID, a free-floating aerosol transmission thing or droplets that quickly fall to the ground, we actually had literally direct pictures to show us that it floats in the air for a long period of time, well over a year ago. And because this is like against the countervailing narrative of how these kind of respiratory infections are transmitted, this evidence was largely ignored until quite recently, which is, yeah, it's shocking to me, the divergence between what I thought is how things should work, because kind of like science influences policy, to more be like, no, policy just happens based on personalities and history, and science kind of goes along down here until maybe or maybe not somehow it manages to break through and actually change policy. The other data I found really compelling was evidence that was gradually increasing over time about the difference in infection rates between countries that had masks mandates or masks, universal mask wearing early on versus those that didn't. And this was a kind of frustrating thing to work on, because as data scientists, one of our key areas of expertise is knowing how to control for covariates, to kind of handle endogenous and exogenous variables, and to present a piece of work like this correctly. But like literally every time I would share this kind of analysis, dozens of people would come out of the woodwork and just assume it was done in the most naive way possible. But actually there was a lot of top statisticians spending lots and lots of time doing stuff like this. And in particular, Chris Loeffler, who did this, by far the best work in this area, he just spent months and months and months trawling through thousands of newspaper articles from all around the world and translating them, and in order to gather this data and figure out all the possible confounders and control for them. And interestingly, Loeffler himself is actually a top ophthalmologist. He does have a Master of Public Health as well, but his job is as an ophthalmologist. And like, it's interesting to see how in this pandemic, a lot of the really powerful public health work has been done by people going outside their lanes, people like me and people like Chris Loeffler. So, other data which was really interesting, there's actually, a little bit later in the pandemic, there was a study that actually just directly compared families that had mask usage in the family versus those that didn't. And looked at transmission in the home and found that masks were something like, 5 times, lower transmission rates than no masks. So that was a super useful study. Again, it's like one that generally epidemiologists wanted to ignore because it's an observational kind of study. But that was the challenge we had, is the kind of studies that you can do for masks were different to the kind of studies that actually are generally accepted in that community, where else randomized controlled trials are impossible for studying source control for masks. Another interesting area of study around the kind of the data was the difference between mask mandates versus mask recommendations. Particularly in America, there was a very common refrain, still is, around don't tell people what to do, just request. So a lot of places, as it started to become clear that the science was backing up the use of masks, a lot of states were just, the governors would say, please wear masks. But then other states, governors would say, you have to wear masks. And so interestingly, the data around that was showing that the mask mandates requiring masks makes a huge, huge difference. And certainly we see that in Australia, like here around Queensland. Basically, when I go out, nobody wears a mask ever, unless there's a period of mask mandates when I see like basically everybody wearing a mask. So at least in Australia, you certainly see compliance is really good when there's a mandate. There's lots of kind of arguments around For example, that people saying, oh, if you wear a mask, your people will be less careful. So you shouldn't tell people to wear masks. If they're wearing masks, then they'll stop being careful with things like social distancing. And, you know, unfortunately, the people making these claims, who are often very senior public health officials, weren't working on the basis of data and analysis, but were working on the basis of their intuition, basically. And people were actually getting data around whether this was true or not. And the data actually showed the opposite. The data actually showed that people wearing masks generally were more distanced, you know, better social distancing than people that didn't wear masks. So, you know, again, people were doing a pretty good job of doing the data and, you know, getting the data and doing the analysis we needed. But policymakers didn't generally do a very good job of taking advantage of that. WHO in particular were very, very slow to recommend masks, and it's still never really made a as clear a statement as they should. And so what happened with me was so in the US public health bodies pretty quickly started taking a strong direct interest in my work. And within a week or two of starting my work, I was briefing a joint session of 10 Senate officers. I was briefing a senator who was in turn briefing the president on the same day. You know, there was a lot of genuine interest and engagement from the US political community with my work, and it directly impacted policy. WHO was not at all the case. They were very distant, and there was this kind of small community of epidemiologists who all knew each other and didn't show any interest in listening to our science. But eventually, we did manage to get a meeting. Somebody needs to be muted there. We did eventually get a meeting, and so I actually got to brief the top WHO committee that was responsible for their policies on kind of infection control. And so before that, I studied closely the work that WHO had sponsored on this field, and actually turned out it was riddled with huge mistakes. And so this was an example of one of the slides I actually presented the WHO, where I, had to basically get out there and say, the stuff that you're working with is totally, totally wrong. So they were looking at studies that were of totally the wrong thing. They were doing the wrong kind of statistical tests. And, this is where, like, they didn't have any data scientists on their committee or statisticians. So, like, I think there's a really big opportunities for data scientists to support public health by just checking the work that's getting out there, and just making sure that it actually makes sense and it's done correctly. Ideally peer review would do this, but it doesn't really happen in practice. Reviewers don't have the time, I think, and often they don't have the expertise to check this stuff carefully. I also found a lot of people were creating great data around what kinds of masks should people be wearing. And so I shared that with the WHO as well, because again, the WHO were expressing, some pretty questionable opinions about if you are going to wear a mask, what kind of mask should it be? And then, other interesting data was based on things like fluid dynamics experiments, which, again, epidemiologists were ignoring this kind of evidence because it wasn't normal epidemiology kind of evidence. But, I think, again, something that data scientists can do is to help bring together all the different kinds of evidence and show how they can be combined to, give an overall picture. And so I kind of saw that as my key job, particularly with the evidence review paper we did. was to, bring these 140 references together and say, look, we've looked at all of them, and here's what it all means. Now, one of the interesting things in these fluid dynamics experiments is it showed that different types of materials could make a really big difference, and that actually simple cloth masks could actually be super effective. So, moving from the kind of the science to the messaging, on the one hand, I had to try to, bring together and understand the science. But then I had to communicate a message, and that generally that message I was communicating was on TV or through mainstream print publications. And so that's a very different kind of communication that's required. And so I found myself, like, for things like fit, I kind of was studying the evidence, but then actually trying to put together, jerry-rigging together, trying to show examples of like how you can actually create well-fitting masks. Because, in the early days, in March of 2020, there were no masks. You couldn't buy masks, at least not in America. So we had to make them. So this was very uncomfortable for me. I'm not a crafter, but I literally set up a camera in the backyard and made a video of me cutting T-shirts and showing how to tie them up into masks, and getting hundreds of thousands of views of me crafting. And I guess, like, the message here is basically, like, as data scientists, we cover a lot of territory, and quite often communicating what the data says and taking advantage of that requires actually going beyond the data and trying to be somewhat practical. And this video, because of its popularity, it was watched by a lot of people in the mainstream media. So, for example, the Guardian contacted me and said, we want to create, a nice graphic of this approach, and we're going to write an article saying how to do this based on your video. And so I got sent these, drafts, and ended up with this whole, pictorial graphic of how to make your T-shirt mask. And yeah, these T-shirt masks actually work pretty well, although nowadays we generally can buy them, masks. So yeah, that became another part of my life, was kind of Bill Nye the Science Guy thing, where I was doing public experiments to try to show the reality behind the data. So, I'd studied the data around how masks block the tiny respiratory droplets, but I kind of had to find ways to show it visually. So I did another video of kind of showing that. And yeah, it was, I guess in the end, both were important. I had to do the science and collaborate closely with domain experts to kind of know what the right answer is. But then also I had to find ways to express what our findings in as kind of compelling and clear a way as possible. So before I would kind of go on a TV interview, I would chat to other people, and we'd try to come up with like expressions or phrases that would capture as visceral a way as possible kind of the messages we were trying to get out there. So yeah, that's basically my journey to here. It kind of, life stopped while I did that. It was, I had very little time to work on fast AI stuff. I, didn't have as much time with my family. It was pretty all encompassing. It's super stressful work because a lot, there were a group of people who were very against masks, and everything became pretty political. And it got to the point in July of last year where I thought, okay, look, I think I've done what I can do. we created a whole website for Masks for All. We had got the WHO to change their messaging. We'd got the CDC to change their messaging. I'd worked with governments in England and South Africa and various ones around the world. And I kind of thought, okay, look, I think at this point, people know they should wear masks. And I retired. And basically since that time, I've gone back to my normal life, which has been very good. And so here I am.
Thanks very much, Jeremy. I really enjoyed the talk. So different angles that you had. So, okay, we got like 10 minutes for the questions. Yeah, please welcome if you have questions.
I got a question for you, Jeremy, if I can unmute myself. Yeah. Can you hear me?
Yeah.
Yeah, cool. Thanks for the talk, man. Very interesting. I wanted to ask you a couple, I've got a stack of questions for you, but I'll just try and limit myself to two, let some other people get in. One thing I wanted to ask you was, there was a lot of kind of, maybe not scientific evidence, but empirical evidence that masking works, considering that it had previously been used in Asian countries to control other coronavirus outbreaks, like particularly the SARS outbreak and that sort of stuff. Why do you think that in the West, that sort of evidence it doesn't seem to have been taken seriously?
Yeah.
Like, do you think it is kind of an East-West kind of thing? Or
Yes, it is.
Reason like
yeah, it is. So so the effectiveness of masks against respiratory pandemics had been pretty much sorted out during the 1920s. There was a Chinese-Malaysian doctor called Wu Liantu, who spent decades of his life on this question, on very, very virulent outbreaks. And when he started out, masks were not really used much anywhere. They had been used a little bit on and off for 600 years, but it wasn't really a common thing. And him and his team as healthcare workers had to figure out how to protect themselves, because they were working directly with highly virulent respiratory pandemic patients. And they went through many generations, iterations of cotton and gauze masks and silk coverings and so forth. And they, came up with a recipe that worked for tens of thousands of healthcare workers over decades. And it was thoroughly studied, documented, and it was actually very popular around the world, particularly after a French doctor who actually took control of the Manchurian plague from Wu Liantu was an anti-masker, and within days he had died after walking around, without a mask. And what happened partly was, in the West, we didn't really have many more respiratory pandemics post the Spanish flu. And so there wasn't this kind of reminder, where else in Asia there was quite a few. And so it kind of became something people were just used to doing. So it's partly a historical accident, but it is partly also just a race thing. I found that my attempts to talk about the experiences in Taiwan, Mongolia, Hong Kong early in the pandemic were largely ignored by the media and public health people. When I talked about the Czech Republic, then people listened. And so I could say like, oh, in the Czech Republic, here's what happened. And people were like, oh, wow, tell us more about the Czech Republic. So in my first article in the Washington Post, I had a whole paragraph about the story about this particular bar in the Czech Republic where the people there had like borrowed sewing machines from the community and started stitching masks together. And, I literally was chatting to these people over Twitter DM, learning about their story and getting pictures and stuff. And yeah, people really respond much more to people who look like them. And even the Czech Republic's a bit of a problem because they don't speak English. They also, people also like to listen to people who sound like them. So that was why it's so important to have like English language materials out there.
Thanks. The other thing I was just going to ask you, maybe more as a bit of fun, is you mentioned that you've been going on US TV and all this sort of stuff, and you know, like sometimes you'd appeared or you know been in the same circles as like Dr. Fauci and that. I wonder, have you copped any like of the sort of like he's targeted by a lot of maniacs associated with QAnon as like this demonic figure and all this sort of stuff. I wonder, have you ever experienced anything like that?
Yeah, I've had death threats and abuse. Yeah, it is stressful, you know. But that's just the nature of it, sadly. You know, I mean, something which affected me more, I think, early on was some of my own, I would say, colleagues, people from the AI community, were very negative about the fact that I was not in my lane, you know, and so I received basically ridicule from senior people in the AI community about the fact that I was doing stuff that wasn't AI. And I got to say, I found that pretty upsetting.
I can imagine. Yeah. All right. Sorry, that was supposed to be a fun question, but
Yeah. There is another question in the chat. It says that I will read it. So it says, what is your take on the strong reluctance by the public agencies such as WHO, CDC on updating their messaging in a way that contradicts previous advice? Also, welcome back to the normal life. It's from Jay. So,
yeah, look, the thing is, public health bodies have a tendency to express things based on intuition or weak evidence in extremely opinionated ways that make it really hard to walk back. You know, so like the Surgeon General saying, don't buy masks, they don't work. Like, it's very hard to say like, oh, actually they do work. It's like, because it's such a strong opinion. So there's been this kind of constant problem in the pandemic of public health bodies saying, you know, the WHO is saying, you know, big graphic, COVID is not airborne. Like, that's it, you know. So because they don't express it as like, based on the evidence so we have so far, it's not yet clear whether or not it's airborne, that's very easy to walk back, you know, it's to say like, oh, we now have evidence that it is. And so I find that there's a tendency from public health bodies to treat the public like a bunch of fucking morons, you know, that you basically just have to tell them X and then tell them Y. And then they get frustrated when the public doesn't do everything they're told, but they're being told exactly opposite things, and they're always like equally strongly worded. So yeah, I think there's a real failure of respect for people, you know, and your ability to communicate with them honestly. So like with the masks, for example, I wish they had said, masks are really important. You know, and unfortunately, we don't have enough to even protect our hospital workers, and they're in the front lines. Let's all do everything we can to protect them. And let's, you know, if you're out in their community, help us make more. But instead they say masks don't work. And so it becomes this real roller coaster ride for people of just this messaging that doesn't make any sense. And it leads to distrust of public health. And that's a problem, you know, not just in the pandemic, but just for stuff like vaccination messaging and stuff like that anyway.
Yeah, right. So maybe there is another related question. It says, it's from Kurt. It says, how has this experience changed your approach, if at all, to data science or to business more broadly?
I don't know. I don't know. We'll have to see. Like, honestly, it kind of wore me out. And so particularly with moving to Australia, I've decided to spend my time on, you know, things like learning to windsurf and settling into Australia and stuff. So we'll kind of see. But I mean, maybe that's part of how it's affected me is it's just I don't know. Yeah, we'll have to see. It's certainly, I've learned a lot from the process, and it certainly it's been encouraging in terms of understanding how you can put together a scientific collaboration and how you can collaborate, across the world. But honestly, it's not something I would, not something I'd want to do again.
Maybe the last one. It's from Yanis. It says, if you had to choose only one of the two following mitigation measures, masks or distancing, which one of the two would you pick?
I think the answer is it depends. So a big problem we have in Australia is that people are wearing the wrong masks. So people in Australia are generally wearing surgical procedural masks, which are okay at source control, so protecting others from you, but terrible at protecting the wearer. If we were wearing N95s or even KF94s, which are fantastic Korean masks, and if they were worn properly, I'd say that's probably best. I wouldn't ever pick distancing on its own. I would only pick distancing combined with, excellent ventilation and air quality controls, because otherwise distancing indoors in a small indoor area is not very useful, because the airborne particles still are going to gather and gather and gather. So I think, one thing we're still missing in Australia is this understanding of ventilation and air quality.
All right, thank you. So I guess, we got all the questions. So thanks very much, Jeremy, again. It was really interesting talk and exciting. So thank you again.
Thanks for having me.
Thanks all. Yeah. Bye.